Hi, my name is Todd, and I wanted to talk to you a little bit about something that a lot of people don't talk about, and that is the right kind of charting. Some of the best nurses I've ever worked with, they've gotten Medicare denials in their charting. It's not because they gave poor care, but because the chart just really didn't tell the whole story. And I know that this has probably cost my agency, thousands of dollars when a whole visit gets written off because of improper, documentation to tell the whole story. I've done it myself, I'm sure, and we get emails that say, this is what you need to do. This is got to make the chart show a better picture of what's going on. And I'm a rural health nurse. I cover 3 counties, sometimes 4. Drive 80, 90, 100, 120 miles a day. And out in the rural field, we see all sorts of patients. Wound patients requiring wound vacs, congestive heart failure, post-op patients, diabetes, respiratory failure. That's the whole gamut. And after 26 years of being a nurse and over 10 years of being a home health nurse, I really kind of honed in my clinical skills, but I found here lately that I needed to start beefing up my charting skills. That was a weak area because I was getting the emails. You need to do this, that, and the other so that Medicare won't deny the notes. And so, I used to be writing, vital signs within normal limits, patient stable, and I'm guilty of doing, copying and pasting too, especially when it's 9 o'clock, 10 o'clock at night and you're still charting on these patients. The last thing you want to do is really crank out even more detail, and it just seems like it's just another Medicare thing that's, being put on you. Well, as I've gotten more into this, I decided that I would create a YouTube channel and begin this journey together about myself learning about what Medicare is really wanting in charting and notes. And decided that why not, bring others on the journey too. Here's the truth about it is, Medicare, they really don't see your visit. They don't see you. They don't see the patient. They're just relying on the words that you write on the chart. And sometimes this can be a real gap between what they see and what is reality. But we have to understand that, if we didn't document why it was required for skilled nursing to be there in the first place, what risk existed, without you being there, and what would happen if your care stopped. So I'm just trying to, as I'm charting, think about a 3-question framework that naturally will answer those questions of why is skilled nursing care needed? Is there any changes that are happening in the patient? And what happened if the services that we were providing were to be stopped? So I've been guilty of this. I write down an example of this case, patient stable, wound healing, no issues. But there's a bigger picture that's being missed. This is a little bit stronger here. It says, Wound shows 10% reduction in slough, but continues to require skilled assessment due to the risk of infection and need for ongoing negative pressure management. Without skilled intervention, patient at high risk for, delayed healing and rehospitalization. And so, if this has ever happened to you, it doesn't mean that you're a bad nurse. You were never really trained to think like a Medicare auditor. Most of us were trained to give good care, not defend it on paper. But in this day and age, that's kind of what we have to do right now. But, there is good news coming out of this, and it is fixable. It's structure, it's clarity, and it's learning to tell the clinical story. And so that's why I built this YouTube channel, to help good nurses, protect their license, help their agency that they're working for so that they can stay in business, so that you can have a paycheck and keep food on the table and gas in the car, and to have a better peace of mind. Because documentation should support the care and not underdetermine it. So, if you made it this far, I appreciate it. I'm hoping that I can give you valuable information to help you along in your journey, especially if your agency is giving you emails about, different things that you have to adjust on your charting. And, if you ever felt unsure if your note would pass an audit, drop stress maybe in the comments section if charting anxiety is, real for you. And if this helped you see documentation a little bit differently, come back to the channel. I'm going to continue, breaking down this thing step by step. I can honestly say I'm not the expert on this, but I'm trying to learn. And I know that, AI can assist in this charting, but one thing is certain. Don't use IA to create your chart. It's there as an assistant to help you pick out the details and not forget certain steps and things, because we don't want to use AI in the wrong way. So I wanted to, throw that out there. But anyway, thanks for listening, and we'll catch you in the next video.